everybody. My name is Dr. John Blanchard. I am a family physician from Salta Direct Primary Care, and I'm here in Michigan. Today is April 6th, and this is the 14th day in the COVID camper. Um, Today we're getting a lot of questions about masks and when to wear masks, what kind of masks. It's best to it's recommended now to wear a mask when you're in public, like grocery stores and places where you need to do some social distancing. Again, we're still under a quarantine to try to stay home as much as possible. But if you do need to go out, it's a good idea to wear a mask. We're recommending using a cloth mask of some kind, not a surgical mask or medical type mask. Those are masks that need to be reserved for people that are in healthcare and on the front lines of this. We also recommend not using a mask for children under age 2. We should try to keep them at home anyway. But today I'm going to show you how to make a cloth mask. There's a lot of different ways to do this. You can look on the internet and see different ways. You can go to the CDC website. They demonstrate how you can make a mask there. This mask you can wash after you've used it. Put it in the laundry and wash it on hot water. The mask is not going to protect you from viral particles that come in the air, but it will help to prevent you from spreading the virus if you haven't come down with symptoms yet. We know that people can spread the virus even for a few days before they actually develop symptoms. So if we're out and about, this will help to prevent this virus from spreading. So what you'll need is a piece of cloth about the size of a bandana. You can use a bandana or cut a t-shirt, any type of cloth. You need a couple of rubber bands or the hair ties, or you can use, and you want to have a coffee filter, okay? So what you do first is you just fold this in half, and then you fold it in half again from the bottom and from the top. And then you can take your coffee filter and you put that in the middle. And then you put your rubber bands on each side. And then you want to fold this over like this. Okay. And now you can take it and put it on your face. You want to kind of hold it in place and then put it over your ear on either side. And there you have a face mask. So again, this is very easy to do. You can do it this way, or you can find another way to do it on the internet. But that's just something that's being recommended that you wear out in places where you'd otherwise social distance from each other. One of the things that I hope that comes out of this, again, we've talked about before, is the idea of mindfulness and taking the time to understand mindfulness so that it can help you to be more resilient in the face of stress, especially stress right now with this virus. And we talked about black and white thinking as a thought distortion that people fall into. Another one is called personalization. You might be personalizing if you take responsibility for something that happened that isn't your fault, that you take it personally, that you take responsibility for something that you don't have control over or have anything to do with. Another example of personalization is if you take it personally that somebody willfully left you out of something or said or did something that was meant, and you take it personally, but it wasn't meant to be personal. And that's another example of personalization. When we fall into thought distortions, it affects communication and relationships, which is a really big problem because relationships are the most important things that we have in our lives. But it also drives the stress response, drives anxiety, drives depression. So black and white thinking, personalization, two very common thought distortions. You can look those up on the internet and you can learn more about them. One of the things I like about being a direct primary care doctor at Salta Direct Primary Care is that there's no surprise billing. So one of the big things that's a problem right now is, especially with people with high deductible plans and those kinds of things, is that they go to the doctor and you have no idea what kind of bill you're going to get. There's virtually no other industry where you don't know what your bill is going to be. If you go to the grocery store, if you go shopping, if you are going to buy a car, you know what you're buying, you know how much it costs. You hire a service, you know what the service is going to cost roughly, and that doesn't happen in healthcare. And so a lot of times people get these big bills in the mail. What I like about direct primary care is that it's one flat fee. So it's all the primary care you can consume for around $90 a month, and we can take care of up to 80% of a person's problems. So people will often join Salted Direct Primary Care and then have an insurance plan that covers all the expensive stuff. So, like if a person ends up in the emergency room or the hospital or that kind of thing, they use their insurance, but they pay directly for our service. And in doing that, they know what their fee is. It's $90, and it covers everything: unlimited visits, no copays, no deductibles, as many visits a person needs throughout the year, 24-hour contact to the doctor, and that's something I really like about it. It's very simple, very easy to understand. It's like a gym membership for primary care. So if you want to learn if Salted Direct Primary Care can work for you, you can go to facebook.com/Salt of Clarkston or facebook.com/Salt of Troy, or you can call Kyle at 248-922-3076. Again, this is Dr. John Blanchard from Salted Direct Primary Care. Stay safe out there, love each other, get your masks on, and stay home. But if you do need to go out, wear your mask. Okay? We'll see you again tomorrow.